Hello, class. Welcome to this course in clinical psychology with Bay Path University. My name is Dr. Courtney Morris, and I will be your instructor for the 6-week online course with Bay Path. We are going to be doing a very strong overview of many of the basics and nuances to the field of clinical psychology. We'll be examining how it is similar and different to other fields in psychology, and what are some of the practical skills and knowledge that is important to have a strong grasp on to best provide clinical care to a client. We'll be taking a look at the American Psychological Association ethical codes and how those ethics are integrated in our practice. We will also be taking a look at how do we conceptualize a case? How do we better understand how their past and experiences and background uh, help us understand who they are as a person and what their challenges are? How do we diagnose or examine differential diagnoses, the pros and cons? How do we also consider case formalization and treatment planning? Many a times we integrate different forms of assessments to help us with this, whether it's self-report measures, personality, psychological assessments, or neuropsychological assessments. And depending on the differing fields of practice we are in, we will certainly call upon some form of assessment. What do the interview process look like? And what are the different types of tools we have for interventions? So it'll be a very strong and broad overview of many of these things that we want to be able to become more proficient on and what helps us strengthen our critical thinking and our clinical skills. You'll be able to do this in a variety of ways throughout our assessments in this course. You'll be able to do this both by some case examples, being able to go into depth on the background of the case and what helps you better understand how to approach case formalization and treatment planning. You'll be able to get into depth about differing forms of assessments, which will be very interesting, and learning different evidence-based psychotherapy approaches and what makes a therapy approach evidence-based or not, and what are some of the strong theoretical orientations that these interventions stem from. What kind of research has helped us best understand what interventions are the best fit for which mental health conditions. Very broad in a very short amount of time, so it's going to be quite fast paced. Please take note that the week of Thanksgiving we will be off, and then we will pick back up the week after. So this will be 7 weeks, a 6-week course skipping that week. Every week you will have a discussion post that is due by Thursday night at midnight. Then we are hoping that you can respond to at least 3 of your peers' original posts by Saturday night at midnight. You will also have 2 assignments due every week. There is a grading rubric assigned or attached to each assignment, so please take a look at that. That will provide a lot of clarity on where the points will be coming from and what criteria is needed to do well on the assignment. I will be posting weekly videos to kind of have some key points to pay mind to provide some feedback around some things that are coming up in the course. So please take a look at those. Also, whenever possible, integrate appropriate empirical research in your assignments and follow APA formatting, the American Psychological Association formatting when you can. You can email me at any time with any questions. I'll do my best to get back within 24 hours. It's COMORRIS. And a couple little things about me as well. I am a practicing psychologist. I work at a VA hospital providing psychotherapy in a brief, rapid model in a primary care clinic to veterans. I provide brief assessment and therapy, and I also do a lot of referral management and helping veterans get connected to other higher levels of care for treatment that are appropriate and help individualize that process. I've also been teaching here at Bay Path for about 10 years, and I absolutely love working with students with a focus in psychology. And I have my master's degree from Fordham University and my PhD from the University of Denver, and have done differing types of research as well in psychology. I really love teaching psychology courses, and am happy to help with any questions you might have, not just related to the course, but also related to professional development, as appropriate, and if I can help. Um, this will be fast. No late work is accepted for credit weeks 1 and week 6. There are federal guidelines and reasonings for that. And on a case-by-case basis, weeks 2 through 5, if there is something, of course, that comes up, life happens, please give me a heads up if you need to be a little bit late. There is this 4-day window where I can accept late work, although some points are reduced or taken off because of lateness. But correspond with me about anything that's coming up, and we'll try to work with one another. Again, please don't hesitate to reach out if there are any questions at all, and I look forward to working with you throughout this course. Take care. Bye. Oh, sorry, one more thing I meant to mention almost before I ended this call with you, this video with you. The text for this class is something that needs to be purchased or gained on your end. I have submitted another announcement video related to that. I've included the link for how to gain that text. I'm sorry, there might have been a glitch with the bookstore in having that listed underneath our section, but that may have been resolved by the time that you take a look at this video and get ready to get that text for yourself. But you're able to rent or purchase and access it in many different ways. And so if there are any questions at all about that as well, please don't hesitate to reach out. And there's a lot of other information provided in Canvas, but the text is important to gain. All right, thank you so much. Take care, and I will be providing another video soon.